Welcome back. Did you know that March is Colorectal Cancer Awareness Month? While the month is wrapping up, it is still important, especially for adults ages 45 and older, to be aware of their risks. So today, Dr. Larry Seamont, the Senior Medical Director for Louisiana Blue, is here virtually to talk about the importance of screenings and, of course, your risk factors. Dr. Seamont, welcome back.
Malik, it is great to be back. Thank you so much.
Yes, I'm so glad we're talking about this because this is something I did not know that we talk about this during the month of March. Let's talk about the severity of colorectal cancer. How prevalent is it right now in our communities?
That is a great question and something all Louisianians need to know. Louisiana has a colorectal cancer rate that is 50% higher than that of the rest of the country. We have the sixth highest rate in the entire United States. And colon cancer has now become the leading cause of cancer death in men and women. That's important because a lot of people think of prostate with men and breast with women. That's not the case. Colon cancer is the leading cause of cancer death in both men and women.
That is very alarming, and I'm glad that we're talking to people now on TV about the importance of getting your colorectal screening, also known as a colonoscopy. First, let's talk about this update. It used to be 50, but now it's 45, Dr. Seamont?
That's exactly right. People hate thinking about age, okay, but 45 is the new 50 when it comes to screening for colon cancer. This has become in the United States, and we're not quite sure why. We're seeing the incidence of colon cancer get younger and younger. And so if you catch colon cancer early, it's got a really high cure rate. But if you turn 45 years old, you are now in that risk range where it's time to get screened, which is new data and very important for people to know.
So everybody look at your birth date right now. You think it might have been 50, but now it's 45, okay? But I gotta be honest, I feel like there's a lot of stigma around a colonoscopy, right? A lot of our elders will talk about, I'm going for my colonoscopy, yada, 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 but obviously it's important. What does the procedure look like for those of us who have not turned that age yet?
I can tell you, it's not what it used to be. And I'll use the phrase, it ain't your father's colonoscopy. I remember being in high school, helping my dad prep for his, and it was, gallons and gallons of prep juice for hours. That's not the case. I'm over 45. I have had mine, and I can tell you, it was a couple of hours drinking some prep. It tasted like lemonade. The next day, I had the colonoscopy done, and I was back at work the next day. So you don't have to take a lot of time off of work. There was no pain at all, at least for me, associated with it. The prep was a lot easier than I ever thought it was going to be. So it really isn't that big of a deal now. It's a lot easier than it used to be. You don't have to take a lot of time off of work. There's not any pain associated with it. And again, if most health insurances are going to cover it at zero cost or near zero cost because of how important the screening is.
That is so great to know that there's not a lot of prep work, but the reason why you do the prep work is to clear out your system because the doctor then goes in there with an instrument to look for these things called polyps, right?
That's exactly right. Yeah, so you are usually given some kind of sedation or anesthesia, and then the doctor inserts a camera that allows them to look at the insides of your entire colon. And they're looking for polyps, they're looking for masses, they're looking for lesions, they're looking for inflammation, they're looking for anything that might potentially develop into a colon cancer. And what's nice about the colonoscopy, as opposed to just about any other way of trying to look for colon cancer, if they see a polyp, when they're in there with that scope, they can get rid of it. It's done right there. If they see something, they can biopsy it right there. And so then you're taken care of. Polyps are gone. You know what you have. There's nothing else left to do.
Ooh, thank God for some sedation, okay? Because the camera, ooh, Lord. I'm so curious, like you mentioned earlier, 45 usually is the age most people need to start getting their colonoscopy. Are there any other risk factors or groups of people who maybe have to get a screening earlier?
Yeah, that's a great question. There are two different things you want to be thinking about, all right? Family history is a really big one. If you have anyone in your family, especially anyone that had colon cancer before age 50, that's a big risk factor. Also, people that have what are called the inflammatory bowel diseases, Crohn's disease and ulcerative colitis, they're also at higher risk of colon cancer. If you have either of those two conditions, talk to your doctor this week. It's Colon Cancer Awareness Month. It's March. Call your doctor and talk to them about what you need to make sure that you do not die from colon cancer.
And a great time to talk about this is doing your annual visit, which we all need to make sure we
Exactly
do that
right.
for sure. Like Dr. Simon and myself have been saying, this is the leading cause of death for both men and women. So it's important that you know your risks. Dr. Simon, thank you so much for being here. Look, everybody, for more information about colorectal cancer risk factors and screenings, log on to lablue.com. All right, coming up next, everybody, we're switching gears. We've got a great pop-up restaurant in our Aquista Paces kitchen. We're making sushi after the break. Don't move.